Kenya. Now, much has been seen and said about the coronavirus ever since it penetrated Uganda in March this year. However, a big section of the public still does not believe that COVID-19 kills. A number of people actually think it is a political ploy to gag the opposition, while a number of others think that the disease is for white people. And worse still, others say they just do not care. But the fact is that the infection has killed many people and has left others who have survived. Now this is their story.
The current political atmosphere has made it hard for the larger part of Ugandans to appreciate that COVID-19 is real. But those that have come face to face with COVID-19 now know the importance of following the standard operating procedures.
At about 10:40, they told us that he had died. He stopped breathing, heart stopped pumping, brain dead. He was gone.
Dr. Francis Chitaka Jr. lost a father to COVID-19 on the 12th of September 2020, while Merida and her one-year-old baby and Shadrach were admitted at Mulago National Referral Hospital for treatment this year, in October and August respectively, after testing positive for COVID-19.
And he says, Shadrach, they found out you have the virus. I was actually surprised because I was okay. I actually told him, I'm okay. How come I have the virus? He's like, no, you're positive.
My husband was tested positive and he was admitted in Mulago. That's how I also discovered that I had COVID-19.
This ailment has affected the way they each look at life now.
At the beginning, it appeared like it was a disease very far away in Europe, maybe for the white man, and blacks were resistant because of the sun and other things. But I tell you, COVID is here.
I think people should know that without the symptoms, that doesn't mean you can't have the virus. You can have the virus and it can even stick on you. And actually, that's what really perplexed me. The fact that I didn't witness any symptoms, but still I kept on being positive consecutively. That is what puzzled my head.
Because of the stigma, when you develop normal cough and flu, what comes in your mind is maybe COVID has come back again. But when it's actually cough and flu.
Much as some countries have started administering the COVID-19 vaccine, Uganda still has to wait till we can purchase or manufacture our own. According to the World Health Organization, as of 17th December 2020, Uganda COVID-19 infections stood at 29,361, with 225 deaths and over 10,000 recoveries. Wadulo Mark Arnold in Kampala.
Now, medics at the Nambole Isolation Center are concerned that if reluctance of following the SOPs continues, there might be a sharp rise in the infections. Now, Kanari Mugume is at Nambole to share with us an update. Over to you, Kanari. What's happening?
Thank you very much. In my background is the non-traditional isolation center, or what you can call a facility. Because what happens is that if you are asymptomatic and you're unable to get a room where you can isolate yourself from home, then you are admitted here for quite some time. And when you get better, then you are discharged. If the condition gets worse, then you are admitted into the hospitals, regional hospitals and other health facilities that have been put in place, make sure that they manage the COVID-19 situation. Now, this facility here has a bed capacity of 800, and so far they've registered some great success. Currently, they only have about 95 patients inside there who are, of course, not in critical condition at all, but just want to get better and are on medication. They have so far admitted 1,840 since the 9th of September up to date, and they have discharged 1,750 patients, and 53 patients have so far been referred from Nambole to Mulago and other management centers. Therefore, I want to connect to Dr. Chisula Ivan, who is the in charge of this facility. Thanks for joining me this evening. Let's begin from understanding the way this facility works. Yeah. How do you get to admit someone?
Yeah, thank you very much. So As its name says, it's called Nambole Non-Traditional Isolation Facility. So it's non-traditional in the sense that it's not the typical hospital setting like Mulago is, and it's not the home where the person comes from. So the kind of patients who come here are those who are positive for COVID-19, but they either have no symptoms or have mild symptoms, and they cannot stay at home for one reason or another.
So do they need a referral letter from the facility where they tested from, or as long as I have positive results and I cannot isolate from home, and I do not have, and I'm asymptomatic, I can just come in here and I'll be admitted?
Yeah, so our patients come in from different corners. So as long as someone has a positive result, and the good thing is that we have an electronic system, which is the result dispatch system. So someone can actually come here, and as long as they know they are positive, we can retrieve their results from the system. So we don't need one to have a referral to come here. So long as someone is found to be positive. Some people come from work, others come from home, others we have refugees who are coming from different camps.
Okay.
So patients are coming in from different parts of the country.
Okay. Dr. Chisule Ivan, right there, who is the in charge of the Nambole Non-Traditional Isolation Facility. Back to you guys at Mulago Hospital for the joint bulletin on COVID-19.